I'm about to Dr. House the hell out of you guys today because we're going to be talking about the rarest diseases you definitely have never heard of. Let's be real. Getting diseases here and there from so many things is common. You get a flu, use some EpiPen. You get allergies, use some EpiPen. COVID? Use some EpiPen. I'm not a medical professional. Don't follow everything I said except the allergies part. I don't want Dr. Mike kicking down my door screaming chest compressions 3 times because you followed what I said. But anyway, let's start with the lighter ones and move up in severity as we go along. Mirror touch synesthesia. Mirror touch synesthesia is a condition where people feel the sensation when they see someone else being touched. So it's basically reverse Hancock. This condition is because of their brain's mirror neuron system being hyperactive. The mirror neuron system is the one that helps us understand what it physically feels like when an action is done. With it going wacko-wacko more than an average person's, they would literally feel the touch that they see on someone else. When they see someone get a hug, which you probably don't get because you're alone and despondent, they would feel pressure on their chest and arms as if they were the ones getting a hug. Doctors and scientists are still mostly in the dark about the actual causes of mirror touch synesthesia. One of their most popular theories is that the somatosensory cortex and parts of the parietal lobe of the people who have the condition are more active. That's exactly what I said earlier, neurons going wacko-wacko. And while it's a rare condition, studies say that about 1.6% of the world's population could possibly have it. I have never met a person with that, so I guess I've only met the part of the 98.4% who don't have it. The feeling can vary among people who have mirror touch synesthesia. For some, the feeling is slight but noticeable, like they felt they've been slightly touched, but they weren't touched, but they feel like they were, but just lighter compared to an actual touch. You get the point. Some feel as if it's real, and they can't differentiate it from an actual touch. Capgras Delusion, also known as Capgras Syndrome. It's a rare psychiatric disorder where a person believes that someone they love is replaced by an imposter. They recognize that the physical appearance of their loved one is there, yes, but they think something's not adding up emotionally. It was first identified by Joseph Capgras in 1923, and he described it as a delusion of doubles when he saw his patients convince themselves that their loved one is not actually their loved one. That's actually so sad. They have loved ones, but they think it's not them. But what's sadder is you, right now, in the middle of the night, watching this, just to fall asleep. A lot of you are like that. Since then, Capgras delusion has been tied to other mental health conditions like schizophrenia, Alzheimer's, and dementia. Studies have shown that the schizophrenia connection is very plausible because of the symptoms. For example, while a part of the temporal lobe that's responsible for recognizing faces is just fine, the limbic system in their brains, which does the brain-to-heart emotional connections, are impaired. This disconnection prevents the patient from feeling the usual emotional attachment they'd expect when they see someone they love. People with the lighter version of this just feels discomfort, unease, and uncertainty on their loved ones. But the more aggressive one truly believes that their moms and dads are clones that are hiding the real ones. Stoneman Syndrome. If you want to sound like a medical buff, the longer name is Fibrodysplasia ossificans progressiva. It's a rare disease where the soft tissues like the muscles, ligaments, and tendons turn into bones. This is because of a mutation of the ACVR1 gene that controls bone growth. Normally, this gene helps regulate the production of bone morphogenetic protein, critical for normal bone development. For people with Stoneman Syndrome, this is going wacko-wacko a lot more in places where it shouldn't, especially after minor traumas like a bump or maybe even viral diseases. As this goes on, it eventually becomes a secondary skeleton that restricts movement and lock your body in place. I mean, just look at how it looks like from someone who has it. A normal skeleton from the back doesn't look like that. If you can see, the ribs are covered in bones, making it look like a sheet of something when it should have clear division of which is which. Even the parts where joints are like the shoulders, whose main purpose is to make that body part rotate in many directions, is covered in bones, making you unable to move it. The mutation in the ACVR1 gene is typically spontaneous, meaning it often occurs without any family history of the condition, which makes it rare and only affects 1 in 2 million people worldwide. Stoneman Syndrome is diagnosed as early as birth if the doctors find some wrong formation in the big toes. These toes are often shortened, curved inward, or overlapped, which is one of the earliest signs of the disease. But even if it's fine at infancy, the worst cases begin in childhood when it hits the neck, shoulders, and upper back first. As time passes by, the bone formation would spread throughout the body. What makes it sad is that there is no cure for it. The current treatment we have for it is to minimize the calcification of other parts as much as possible, like using corticosteroids. Or maybe wheelchairs and braces could be used to help the person manage and get by. But none of these stop the disease, and they would become less useful if worse comes to worst. Doctors can't even fix this through surgery for the reason that if they try to remove the bone, even more bone will grow back in that place. Alcaptonuria. This disease is caused by a mutation in the HGD gene, and in turn, your body fails to break down some amino acids like tyrosine and phenylalanine. Don't ask what those are, please. When these amino acids fail to break down, a substance called homogentisic acid piles up in your body. One telltale sign of having alcaptonuria is when you pee out symbiotes, also known as peeing black. This is because the HGA in your body becomes oxidized, and boom, alcaptonuria. You typically get this when you're young, but it's most of the time undiagnosed until you become an adult, maybe 30 to 40 years old, and you're still peeing black. Alcaptonuria can step out of its way to give you more and more, like ochronosis, a process where connective tissues like your skin will turn bluish-black and make you look like Mystique and Venom had a child. This discoloration is often visible in areas like the ear cartilage or the whites of the eyes. However, this pigmentation usually doesn't interfere with vision or cause significant problems in the early stages. Now here's the severe part. As long as homogentisic acid builds up in your body, it would reach your joints and breaking them down little by little. When joints break down, it hurts to move and you get arthritis at 30. So to not get arthritis at 30, like this video and give this channel a sub. Not medical advice, but it surely helps. You get it at a young age due to alcaptonuria that by the time you're 50, you already need joint replacement surgeries. But why stop at the bones? I want to break their hearts, says Alcaptonuria after finding out that it can affect your heart too. Your heart valves can turn into bones, and your arteries get hardened too. There is no cure for alcaptonuria. Treatments like nitisinone exist though, but that is only to ease the effects of the disease. Romberg Syndrome. Romberg Syndrome is a disease that mainly targets the skin and soft tissues, but it's just on one side of the face. It makes the skin on the affected side shrink or waste away. You said it only affects one side. Then how is it any different from Bell's palsy? Okay, I'm about to show a photo of a real person with Romberg I found after a little bit of digging on the internet. This is a man with Romberg. Almost everything on one side of his face has either shrunk or other complications. This is a man with Bell's palsy, still with the symmetrical face health. It's just that the other side is weak or paralyzed. Besides, these are two completely different things. Romberg syndrome is something that tends to pop up whenever between your childhood to puberty, and once you get it, it will keep on getting worse until it stays like that. In some uncommon cases, it could affect both sides, but a one-side problem is the more known one, and it affects females more than males. What could possibly be the cause of this rare and horrific disease? Here's the answer. We still don't know, but there are proposed causes of it like autoimmune reactions, trauma, or some abnormality in the sympathetic nervous system. It starts with the slow breaking down of the tissues. Then it goes deeper to the muscles, cartilage, and bones. It would end up shrinking your face, making you look like you have a half-mummified face. People who have this also have their brains affected. They'd get seizures or migraines on the daily. Some of the worst cases would go as far as hemiplegia. Hemiplegia is where one side of your body is paralyzed. Jumping Frenchmen of Maine. You know it's a rare disease from the olden days if the name is as goofy as this. It was first identified in the late 19th century on French-Canadian lumberjacks in Maine and some parts of Quebec in Canada. They would show super-exaggerated reactions to sudden bursts of sounds like loud noises, unexpected commands, or a physical contact out of nowhere.
Alouette, gentille alouette, alouette, je te plumerai. Je te plumerai la tête, je te plumerai la tête, et la tête, et la tête. Alouette, gentille. Hey dude, ça va bien? Ah! Putain de bordel de merde. Il faut vraiment que tu arrêtes de sortir des news.
Besides the horrible skit attempt at French of someone who doesn't speak French, the symptoms of jumping Frenchmen of Maine appears after puberty and can linger in you through your adult life but in a less aggressive way. People who have this are more vulnerable to the symptoms when they're stressed, and they don't have the option to ignore the sudden kaboom in their reflexes, which could be really harmful for the person or to other people. The doctors at that time thought that the disease was something that's passed down, but studies said otherwise. Andine's Curse. The only good thing about this name is the badass name. You can put it at anything, and it would sound cool, but that's about it. This disease is more known as congenital central hypoventilation syndrome. Imagine this. You're sleeping peacefully one day, but all of a sudden the gene that does the work to make you breathe on autopilot while sleeping suddenly goes wild. You'll lose your breathing while sleeping, and it'll lead to hypoventilate. It's when your breathing is too shallow to efficiently exhale carbon dioxide in your body. Now, Andine's Curse God, I hate that name's tied to a disease. Andine's curse is often seen in newborns and is easily detected shortly after they're born. For example, a mom sees that her baby breathes irregularly, and the baby's skin, lips, and nails gradually turns purplish. Because of this, that's how you detect it. If the mom doesn't bring the kid to the hospital, it can lead to some worse complications, or even worse, sayonara. Now, because people with Andine's curse can't rely on their bodies to just breathe when sleeping, the most logical treatment is a mechanical ventilation. It's when patients are hooked up to ventilators to help with their breathing. For people who don't need a constant 24-hour assistance, a CPAP machine is the most commonly used. Wearing it while sleeping may not be an attractive thing to have, but what choice do they have? Andine's curse is a lifetime challenge. Field's condition. The disease is the rarest neuromuscular disease ever. There are only 2 people affected by it, and they're identical twins. Catherine and Kirsty Fields from Wales got the Field's condition when they were just 4 years old. At first, the symptoms were as subtle as you holding in your fart because your crush is beside you. But over time, their muscles wore down, and it became a lot more noticeable. By the time they were 9, both girls needed walking frames to move because their muscles were too weak for them to even stand up on their own. You might think that it's already the worst possible position for them to be in, but their condition even worsened by then, and now they won't get around so much without using wheelchairs. They also lost the ability to speak. They use electronic speech devices to speak now. They can barely move, but Field's condition seemed to have no effect on any of their mental aspects, despite being called a neuromuscular disease. In terms of their symptoms, the girls get constant wild and involuntary muscle cramps, and it affects them when they're stressed. No one knows where their disease came from. It has not been connected to any other neuromuscular disease, as it is completely a thing of its own. They even had so many genetic testing, but the doctors still do not have an answer to the question, where did it come from? And if there is no answer to that, the cure will be far from reach. There isn't even any effective treatment to slow the progress of their disease down, so the best thing that the doctors can do is pain management for the cramps. Proteus Syndrome. The thing with Proteus Syndrome is that it's another mutation in the gene. This mutation makes your skin, bones, and other organs to grow at an abnormal rate. Even if you're lucky enough that the doctors find it in you in your first 6 to 18 months, there's no cure for Proteus Syndrome. This disease progresses fast and normally affects one side of the body more than the other. Let me just get my microscope, because we're about to get deeper. People who have Proteus experience irregular bone development, which results in different arm and leg length. The arms signify that someone's been baiting the master too much with the right hand. And the difference in leg length can only mean one thing. Taekwondo. Nah, just kidding. It means the bones in your legs developed in a not-so-equal way. Different legs mean moving issues. They also develop tumors filled with fatty tissues called lipomas. Above all those, deep vein thrombosis, a blood clot that forms in legs or arms, is also a thing. With abnormally bigger blood vessels, this clot could travel into the lungs, which could make you sick, which could make you even more sick, and congratulations, you have a deadly pulmonary embolism. Another hallmark of the syndrome is its effect on the face. Individuals with Proteus Syndrome often exhibit a long face, a wide nasal bridge, and downward tilting eyes. And those things are only on their own. Add the unequal overgrowing of body parts, and you would be so disfigured. Here's an example what someone with Proteus Syndrome looks like. His name is Joseph Merrick, and he's been called the Elephant Man. Doctors thought he had neurofibromatosis, but it was indeed Proteus, despite not all of his symptoms scream Proteus. This disease is so rare that it only appears in 1 out of 1,000,000 people, and it can be easily misdiagnosed. Prader-Willi Syndrome. Prader-Willi Syndrome is another one of the rare genetic diseases that attacks multiple systems in the body. There are 23 pairs of chromosomes in an average human. Prader-Willi makes the 15th pair go wacko-wacko, and there will be 3 different ways for the chromosome to work, contrary to their job description. 1. The chromosome from the father doesn't work properly. Simple as that. 2. There's no father chromosome in that part at all. 3. The child got the pair of chromosomes from her mom alone, which is also not good. The earliest sign you can see to tell if someone has Prader-Willi syndrome is hypotonia. What the freak is hypotonia? It's a symptom where babies look like a rag doll, and it makes them harder to feed. They struggle with sucking, and it basically slows down their development. Apart from that, they have this common thing about their facial features, like almond eyes, narrow foreheads, and thin lips. Once again, the brain is not safe, because between the ages 2 to 8, people with Prader-Willi will have the hypothalamus of their brain short-circuit. In turn, they'd get hyperphagia, or uncontrollable appetite. The child will never feel full, even if the entire all-you-can-eat chain goes bankrupt. And you know that's about to turn them into Nikocado avocado, but I guess I can't make that comparison anymore unless the kid uses Ozempic too. Now, growing up ain't something easy for people with PWS too. The imbalance in their growth hormones will make them shorter than average. This problem also puts them more at risk of osteoporosis. Paramyotonia congenita, also called PMC, it's a disease that affects 1 in 100,000 people, which is a tad bit more compared to some of the conditions I've mentioned earlier. But to be fair, these bodies consider a disease rare using this criteria. Going back, PMC is a disease that makes your muscles stiff during a physical activity or just when you're in a cold weather. One feature of this disease is that the symptoms worsen as long as you keep using that muscle or if you're constantly in a cold environment. So if that keeps happening, your muscles will struggle to relax after they contract. Your face, arms, neck, and hands are the most vulnerable, but every muscle in your body can be hit with it, like the one you use to breathe and to swallow. Just imagine this. You're living somewhere cold, let's say Africa, which is obviously sarcasm. If you stay in there for so long and you have PMC, chances are your muscles are going to be so stiff that you're just going to fall on the ground because you're temporarily paralyzed. Even if we step back a little and just eat some ice cream. Kaboom! PMC. This is a gene called the SCN4A, or sodium voltage gated channel alpha subunit 4 for long. This gene tells the body to control the sodium in your muscles so they can contract and relax. People with PMC have sodium channels that don't close properly, which in turn delays the reaction of their muscles. When you get an episode of muscle stiffness, expect it to last for minutes or hours in your arms and legs. Alper's disease. Finally, a disease with the word disease. I keep asking you to imagine stuff, but I promise this is the last time. You're a child, and you have Alper's disease. The disease comes up to you when you're only 2 years old. Later, puberty sometimes if we're pushing it. The symptoms begin in a not-so-telltale fashion. What does that mean? It means you can't tell if it's Alper's yet, like developmental delays. But these symptoms hit you so fast, like bang, 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 and that's when you need to start worrying. Because the moment seizures that even anti-epileptic treatments struggle to manage start, it will start snowballing and there's nothing modern medicine can do to stop it. In fact, these seizure treatments like valproic acid can even speed up the progress of Alper's due to liver toxicity. I know it's counterintuitive for a medicine to do that, but yeah, it happens. Now as your Alper's keeps going worse, you will gradually lose the ability to speak or to walk, and your body will twitch like crazy. Then, your brain's gray matter would start deteriorating and it'd make you blind. 1/4 of the total cases of this disease had this symptom. Slowly but almost certainly, it will go down through your body affecting parts like the heart, your breathing, your swallowing, and then worst case scenario, full liver failure. 1 in 100,000 might be rare, but it's still deadly as hell since most of the children that got diagnosed with Alper's never went past 10 years old. Lee's disease, which is also called Lee's syndrome, is one for the books as it hits the brain on the first 2 years of a child's life, rarely later in life. At first, children may learn how to hold their head up high and respond to sounds, but it won't last long. The child will lose these skills and then some, physically and mentally. The cause of this disease starts at the powerhouse of the cell, the mitochondria. Some mutations in the mitochondria can hinder the production of energy, and cells would die. This would give lesions in the brain, which can give you over 75 different routes to the same destination, Lee's. One of the most serious problems with this disease is your lactic acid builds up in the body because there aren't enough oxygen cells in your body. More lactic acid means you're easily tired. On the heavier aspect, heart and kidney problems. Your breathing would not be easy too, since the buildup of carbon dioxide in your blood would make you not breathe normally. And this is actually the main cause of death for people with Lee's. As the condition gets worse, many children would get seizures and muscle contractions that aren't in their control. This is called dystonia. Is your vision getting blurry? Yeah, this is also one of the symptoms of Lee's, because your optic nerves get so weak that your vision would look like this, and if it continues, you'll end up seeing completely nothing. If you're looking for a cure, don't expect it to come in a month. We don't have it yet, but doctors treat these symptoms with supplements such as vitamin B1 and citric acid. But then again, it only slows down or eases the inevitable. Gerstmann-Straussler-Scheinker syndrome. Gerstmann-Straussler-Scheinker syndrome, or GSS, is a disease that belongs in the family of Creutzfeldt-Jakob disease. You almost always get it from your parents genetically because of gene distortion that would end up in a brain damage that gets worse along the way. This was first discovered by the 3 men who slapped their names in the disease in 1936, and ever since, no cure for this condition has been made. Unlike many of the ones I've said in this video, GSS typically starts when you're in your very own middle ages, around 35 to 55. It will begin with your muscles losing coordination, ending up with you being clumsy, unbalanced, and have a hard time walking. When GSS matures, marinates, and simmers in your body over time, these symptoms would go to the next level. But wait, there's more. Not only will you have a bad time moving, but you'll also be speech impeded. But wait, there's more. You will lose control in some of your eye movements too, so don't be surprised if your vision just suddenly goes wacko and looks like it's vibrating in place. You can't stop this from coming, and once it advances even more, you will begin to develop dementia and deafness that gets worse over time, something most people with GSS have. And it's not an easy disease to track as well. Some families would show this combination of symptoms, some would be different. Add the fact that it's extremely rare, so the chances of it being misdiagnosed is high, especially during the early stages. That's why the best course of action to know if you have GSS is by genetic testing. GSS is slow compared to people who have CJD that die in just months. Patients lived between 2 to 10 years after discovering that they have the disease. But the bottom line is the same. Once you find out that you have it, you start living your life to the fullest. There aren't even any treatments you can do to slow it down, just some to ease the pain. And finally, Thanatophoric Displasia. Thanatophoric dysplasia is a severe skeletal disease that almost always leaves the patient dead shortly after being born. Children who have this already have signs before being born. Ultrasounds during pregnancy show very short limbs and narrow chest. After birth, these babies normally have bigger heads compared to their bodies, with short ribs that stops the lungs from developing fully. Though medical technology has made it possible for a small number of infants to survive beyond infancy, their lives are typically bombarded with complications after complications. Seizures, hearing loss, muscle tone being underdeveloped, joint abnormalities, and a lot more that make long-term living close to impossible. It's impossible for me to not be concerned about my own health after making this video, so I'll go to my doctor and get myself checked. Hopefully it's just an acute case of being broke, but I'd rather be broke than die. So yeah, see y'all.